welcome to those who have joined us since we opened. And again, this is a how-to guide Medicare enrollment webinar. People 50 years and of age and older account for over 50% of people living with HIV. And that percentage is growing, and as is the number of people 50 years and older. Likewise, the number of adults living with HIV who turn 65 years of age and become eligible for Medicare is growing. The Medicare enrollment process can be confusing and challenging. That certainly was the case when I enrolled in Medicare. With today's webinar and a follow-up webinar, we hope to address the confusion and, we hope, make Medicare enrollment much less challenging. To get us started, I want to introduce the two leaders of our sponsoring organizations. First is Jesse Mylan, President and CEO of AIDS United. Jesse will be followed by Carol Treston, Executive Director of ANAC. Carol will also give a few housekeeping details. Jesse?
Thank you so much, Ronald, and good afternoon or morning to all of you, wherever you are. Thank you for joining us for this very important webinar on a guide to Medicare, what is specially created for people who are aging with HIV. And I am one of you. And I especially want to say a welcome to you in this Pride Month, where we should all be proud of the advocacy we've done over the years that has made it possible for people like me living with HIV to reach age 50 and over and to head quickly toward Medicare. And I also want to recognize that this month is the 40th anniversary of the Denver Principles, where 40 years ago at the National AIDS Forum being held in Denver, gay men living with HIV took over that conference by declaring that they were more than patients. They were people living with HIV, and they said to that forum and to the world, nothing for us without us. And it has created a worldwide movement that continues to today. And this webinar is part of that worldwide movement. We know that Medicare is one of the most important safety net features in our American democracy. But we also know it was not created for us. In fact, we were not even a thought when Medicare was first created. And today, Medicare still requires more advocacy by us to make sure that it is truly for us. But until our advocacy is completed and we continue to work with CMS and our leaders in the legislature to make sure that Medicare really does serve people who are living with HIV, it's important that we who are approaching Medicare or in Medicare understand how it works for us today, because it is an important benefit for all of us. You know, I often share many of my personal demographics as a person living with HIV and aging with HIV, and bringing that lived experience to my work as the CEO of AIDS United is important. But today I'm going to bring an additional lived experience from my life, and that is this. I got this in the mail this year because I'm clearly Medicare eligible. And this document from CMS is supposed to explain everything that people who are eligible for Medicare should know. Medicare 2023, it's 131 pages of stuff that I should understand, not just me, but all of us. And so I'm so grateful to ANAC and to AIDS United and to our HIV and Aging Policy Advocacy Coalition for pulling this webinar together to help all of us understand Medicare Part A, Medicare Part B, Medicare Part D, Advantage plans, supplemental plans. It's very, very confusing. It requires an understanding of what is necessary for your life and tailoring your Medicare approach to be effective for your life. There are many risks that we should be aware of, and I hope we hear about those today. Financial risk if you make the wrong decision, even penalties that might last for a lifetime. But most importantly, Medicare can help us live the long life that we have been working so hard to achieve. We take our medications, we've been advocating for policy change, we've been advocating for funding to make it possible for us to live. But today we're going to learn about how this particular benefit that American society has created for all of us who are aging and how it can be used for those of us who are aging with HIV. I'm so excited. I know I'm going to be taking a lot of notes because I know that for me, this is as important as it is for all of you. So thank you to ANAC. Thank you to Ronald Johnson, our AIDS United Fellow, and who's leading our work in HIV and aging. Thank you for all of you for joining today. Let's learn how Medicare can take care of us, for especially all of us who are older and living with HIV. Ronald, back over to you.
Thank you, Jesse, and I will pass to Carol. Carol?
Hi, everyone. My name's Carol Treston. I am the Executive Director of the Association of Nurses in AIDS Care, also known as ANAC, and I am a nurse. We are a nursing membership organization, but we also welcome other members of the healthcare team. So we have members who are social workers, physicians assistants, advocates, public health professionals. We were founded in 1987, and we achieve our mission by really creating an effective network of nurses and others to look at various issues affecting people and communities living with HIV. And I do need to add in our last piece here about inherent in all these goals is the abiding commitment to the prevention of further spread of HIV. Next slide, please. Our mission is twofold. One is to foster the professional development, so that's education like today for nurses and others involved in the delivery of healthcare, and also to advocacy is the second part of our mission, so to promote the health rights and welfare of people living with HIV around the world. Before I move on a little bit about our program today, I want to just thank AIDS United, JSI, and the others who have been involved in pulling this important first step in understanding Medicare for people living and aging with HIV. You know, it's something awesome to celebrate, right? That currently more than 50% of people living with HIV in the United States are over 50, and probably half of those are over 70. Wow, none of us expected that. I started as an HIV nurse in 1987, and we were just looking at 6 months to 12 months in advance, right? And now we're looking at a lifetime, 50, 70 years in advance. And so that's wonderful. It's something to celebrate, but it also brings some issues that we haven't really thought about, right? And that is the other co-occurring conditions that people who are aging face. And so HIV may be the least of someone's concerns in terms of healthcare once they reach 50, 60, and 70. And this is why Medicare is so important, right? In the past, we've been able to provide comprehensive care through Ryan White programs. But now as we think about what other places do people need healthcare, is that cardiology, is that physical therapy, is it orthopedics? You know, this is where Medicare really, really comes into play as we think about the overall health status of people living and aging with HIV. So next slide, please. Just a shameless plug for our upcoming conference in New Orleans. All are welcome to attend. So there's registration information on our website. Of course, what could be better than an HIV conference in New Orleans on Halloween weekend? I don't need to say anymore. Next slide, please. We provide nursing continuing professional development to anyone who is attending today. This is what's formerly known as continuing nursing education. We hope that the folks in the audience include nurses, administrators, program directors, because enrolling oneself as well as helping your clients and your patients enroll in Medicare is critical to health outcomes for all. So just a little housekeeping detail here. We will provide 1 contact hour of nursing continuing professional development. Upon completion of this activity, you will receive a link to fill out a quick post presentation quiz. And after you complete that quiz, you will receive a certificate of CNE. And you have to complete this by the end of this year. So you have until then. So you will get information in the mail, in the email from your registration information. And then next slide. So it just says what I just said, but if you have additional questions, you can email our education staff person Sheila Tumulty, Sheila@ANAC.net. And again, I think you'll receive all this at the end of the presentation in the email. Next slide. So as part of our process of continuing education, we define learning outcomes that we hope are transmitted and transferred to learners. And so today's activity, our learning objectives are that participants will be able to discuss the process for enrolling in Medicare for adults turning 65 years of age. You'll also be able to describe the basic steps to enroll in Medicare, and you'll be able to identify assistance programs which Medicare beneficiaries can apply. So that's our housekeeping details about our learning objectives and our continuing nursing education credits. Again, I hope those credits are open to all, but obviously they're important to nurses as part of our licensure. So with that, I believe that's where I turn it back over to Ronald.
Thank you, Carol, and thank you, Jesse. And our presenters for our webinar today are Lisa Liu, who is a Senior Technical Advisor for the ACE-TA Center, Christine Long, who is a Research and Policy Associate, also at the ACE-TA Center, and Ann Calichan, who is Manager for the Bridge Team Project, and Ann is also a certified Shine and SHIP counselor in Massachusetts. So let's get started. Lisa.
Thank you so much, Ronald, and we're so excited to be here with you all today. Next slide. Next slide. So JSI's primary mission is to improve the health and systems of care for underserved populations worldwide, including people with HIV and those who experience risk for HIV and related syndemics. And JSI implements a diverse portfolio of projects across the US and values the lived experience and expertise of staff living with HIV, staff of color, people over the age of 50, and our LGBTQ staff. So the ACE-TA Center is just one of our many projects that aims to help improve the quality of life for people living with HIV. Through ACE, we help build the capacity of the Ryan White HIV/AIDS program community to navigate the changing healthcare landscape and help people with HIV access and use their health coverage, ultimately to improve health outcomes. So specifically, we support Ryan White HIV/AIDS grantees to engage, enroll, and retain clients in Medicare, Medicaid, and individual health insurance options, to build organizational health insurance literacy, thereby improving clients' capacity to use the healthcare system, and to communicate with clients about how to stay enrolled and use health coverage. Next slide. So one of the areas that we focus on is enrolling people with HIV into Medicare. So let's take a closer look at the demographics, which I know Jesse and others have already mentioned briefly. So next slide. As you must likely know, and why we're here today, is that more people with HIV are aging into Medicare than ever before. Medicare is the second largest source of federal funding for HIV/AIDS care in the US, and more than a quarter of people with HIV get their health coverage through Medicare. So with the successful use of ARTs, people with HIV are living long lives and are reaching age 65 when they can enroll in Medicare, and specifically over 1/3 of Medicare beneficiaries with HIV are age 65 and older. Next slide. So now let's look at the characteristics of people with HIV who are enrolled in the Medicare program. So remember, there are lots of people that have been part of the Medicare program for many, many years and for reasons other than age. The chart on top, the circle on top, shows how current Medicare beneficiaries with HIV first become eligible for Medicare. So 61% of Medicare beneficiaries with HIV are under age 65 and qualified due to a disability. The other 39% of Medicare beneficiaries with HIV qualified based on age alone. And this percentage has actually grown quite a bit since 2016, when it was only 21%. So the chart on the bottom shows that 61% of Medicare enrollees with HIV are actually dually eligible for both Medicare and Medicaid. Next slide. So now I'm going to give you a very quick overview of eligibility, coverage, and enrollment pathways, and we'll take, and so we can go to the next slide. So to be eligible to enroll in Medicare, an individual must be a US citizen or a legal resident for at least 5 years, with some exceptions. So there are 3 primary ways that people with HIV can qualify for Medicare. That is being at least 65 years or older, being under 65 with a qualifying disability and having end-stage renal disease at any age. So there's a CMS calculator that you can use to determine Medicare eligibility, and we'll chat out the link to that right now. Next slide. So as I'm sure you've heard often about the many parts of Medicare. So there are 3 parts, and the first part is Medicare Part A, which is hospital coverage. This covers inpatient hospital care, surgery, lab tests, skilled nursing facility care, and home health care, among other things. Medicare Part B includes medical coverage for services from doctors and other healthcare providers, including outpatient care, some preventive services, and home health care. And Medicare Part B also covers medications administered by a physician and durable medical equipment. So this would include medications such as long-acting injectables. So Medicare Part D provides coverage for outpatient prescription drug coverage, including HIV antiretroviral medications. And we'll talk more about each of the Medicare parts as we go through the presentation. So even though there are multiple parts to Medicare, there are only 2 options to get Medicare coverage, and that's through Original Medicare and Medicare Advantage. So let's take a look at those now. Next slide. So here on this slide, we're comparing the coverage and costs of Original Medicare and Medicare Advantage. So let's look at the Original Medicare first, which is on the left of the 2 columns. So Original Medicare includes Part A hospital coverage and Part B medical coverage. Part D prescription coverage, prescription drug coverage is optional for Original Medicare. So for Part A hospital coverage, most people do not have to pay a premium as long as they have sufficient work credits to qualify for premium-free Part A. This applies to anyone who qualifies for Medicare due to age or disability. People who don't qualify for premium-free Part A can pay a monthly premium depending on how many work credits they've earned so far. And you'll hear us reference premium-free Part A and Part A with a premium throughout this presentation. Part B is medical coverage, which is not tied to work credits. And finally, you can add on Part D prescription drug coverage and Medigap supplemental coverage, all within Original Medicare. So now let's look to the far right at Medicare Advantage plans, and this is also referred to as Part C. So Medicare Advantage includes Parts A, B, and D bundled together. These plans may or may not have a monthly premium, and they have a yearly limit on out-of-pocket costs for Medicare Part A and Part B covered services. You cannot buy or use supplemental Medigap policies if you have a Medicare Advantage plan, but some may have lower out-of-pocket costs than Original Medicare. So there are pros and cons to both options, and it's important to compare plans in your area when you're shopping for plans to see which is the best one for you. You can compare and shop Original Medicare and Medicare Advantage plans at medicare.gov, and we'll share a link for this now as well. And if you're eligible for the Ryan White program, including ADAP, the Ryan White and ADAP may be able to help pay in full or in part for Medicare premiums, deductibles, and copayments. So it's important to check with your local ADAP on if they can help with those costs. Next slide. So now let's talk about enrollment. For people who are about to turn 65, you enroll during the Medicare Initial Enrollment Period, or IEP. It's a 7-month period centered around the month of your 65th birthday. So some people call the IEP the 313 period because it starts 3 months before your 65th birthday, includes the month that you turn 65, and ends 3 months after you turn 65. So if you sign up for Medicare during the first 3 months of your IEP, your Medicare coverage will begin on the first day of the month of your birthday. If you sign up during your birthday month or during the last 3 months of your IEP, your Medicare coverage will begin on the first day of the month after you enroll. It's important to note that if your birthday falls on the first of the month, your initial enrollment period is shifted 1 month earlier to include the 4 months prior to your birthday month, that when you turn 65, and then you have 2 additional months after your birthday month. Next slide. And so just to give you a sense, there are a number of enrollment pathways into Medicare, which we have mentioned earlier. And so this shows you an overview of the major enrollment pathways with the initial enrollment period in the center there, centered over the 65th birthday. So there are other pathways to enrolling in Medicare that are shown here, oriented along the lifespan to demonstrate when someone can enroll in Medicare based on their age and specific life circumstances. As a general rule, the longer a person waits to enroll once they become eligible, the more likely it is they will have to pay a penalty. And we'll get into this a bit more in a few minutes. So now I'll hand it over to Anne.
Thank you so much, Liesl. Sorry, I got a little distracted there. Thank you. And my name is Anne Calican. And now that we've reviewed Medicare eligibility, enrollment pathways, and the different parts of Medicare, let's focus on some best practices and things you should consider as you transition to Medicare. The 4 best practices, next slide. The 4 best practices that we will consider are how to find one-on-one enrollment support, ensuring continuity of coverage, actively enrolling in Medicare coverage, and avoiding penalties. Let's explore each of these in more detail. Next slide. So the state health insurance assistance programs, also known as SHIP, provide free local insurance counseling to assist Medicare eligible individuals, their families, and caregivers. SHIP counselors can review your health and drug plan options and assess your eligibility for financial assistance programs that can lower your Medicare costs. They can answer questions about how Medicare works with other types of health insurance coverage you may have. They can also help with more complex issues like dual eligibility for people who qualify for both Medicare and Medicaid. You can find a SHIP program near you by visiting shiphelp.org and using the locator tool. There is a SHIP program in all 50 states, Washington, D.C., Puerto Rico, Guam, and the U.S. Virgin Islands. But note that your local SHIP may have a different name or acronym, such as SHINE, HECAP, or MAP. We are going to chat out a link to the SHIP help to find a SHIP counselor near you. Next slide. In addition to finding a local SHIP counselor, we encourage you to work with your Ryan White case manager who may have a relationship with their local SHIP program or may even be a SHIP counselor. Your case manager can explain how the Ryan White programs can help clients with Medicare costs. They are also familiar with your individual healthcare needs and may understand what kind of Medicare plans will work best for you based on your needs. Finally, ask your SHIP counselor to help you make a list of important things to discuss with your local SHIP counselor and make an appointment during your initial enrollment period to avoid any gaps in coverage or future late enrollment penalties. Next slide. Discuss your Medicare questions with your Ryan White case manager and/or SHIP counselor, and carefully consider the following when deciding which Medicare plan is most cost-effective for you. Medicare Advantage plans have specific provider networks. These plans have co-pays and co-insurance similar to employer-sponsored insurance plans. And many plans may have a monthly premium as well. Most plans offer extra benefits like vision, dental, and hearing, but finding a plan your provider accepts or all of your providers accept may not always be easy. Medicare supplement plans have a monthly premium, but are accepted by any healthcare provider who accepts Medicare. While the monthly premium costs for these plans may be greater than many Medicare Advantage premiums, that does not mean the overall out-of-pocket cost with a supplement plan will always be higher. Questions to consider. Are your healthcare providers in network with any Medicare Advantage plans you are considering? How can your state ADAP help with Medicare premiums or other Medicare costs? If you are enrolled in employer-sponsored insurance through your own or through a spouse's employer, are you able to defer Medicare enrollment without facing a penalty later? And if you are currently active in your state Medicaid program, will you maintain your Medicaid eligibility after you enroll in Medicare, and what will this look like? If you are not active in Medicaid, make sure to find out through your SHIP program or your case manager if you qualify for any other state or federal programs that might lower your Medicare costs. And we will review some of these programs later in this presentation. Next slide. In order to ensure continuity of coverage, a best practice is to confirm that your existing healthcare providers accept Medicare or any Medicare Advantage plans you are considering. The Medicare.gov website is a good tool to compare plans and find the plans that work best for you. A SHIP counselor or your Ryan White case manager can help you create a Medicare.gov account that saves your list of medications and preferred pharmacies to make plan comparison easier. Whether you are choosing a Medicare Advantage plan or enrolling in a Part D drug plan, make sure your medications are on the formulary and that your preferred pharmacy is in network with that plan. The Ryan White HIV/AIDS program, including the AIDS Drug Assistance Program, ADAPS, may help pay for Medicare premiums, deductibles, and co-payments. We are going to chat out a couple links to making sure your providers are in network with Medicare and the Medicare.gov link that allows you to sort of compare your different Medicare plan options. Next slide. The next best practice is to actively enroll in Medicare during your initial enrollment period. To do this, contact your local Social Security Administration to enroll in Original Medicare Part A hospitalization and Part B medical. You can also enroll in Medicare by creating an SSA.gov login. Once you are enrolled in Part A and B, create a Medicare.gov login using your Medicare ID to enroll in a Medicare Advantage plan, or stick with Original Medicare and use the Medicare.gov login to enroll in a Part D drug plan and consider adding a Medicare supplement plan. We reviewed in the previous slides important things to consider when enrolling and comparing in Medicare plans. Most people who are eligible for Medicare must actively enroll in coverage, but there is a small subset of people who will be automatically enrolled, including people who are receiving Social Security retirement benefits prior to age 65 will get automatically enrolled when they turn 65. People under age 65 with a qualifying disability who have received 24 months or more of Social Security disability benefits, again, get automatically enrolled in Medicare Parts A and B at that 25th month mark. People with end-stage renal disease or ALS, also known as Lou Gehrig's disease. If you are among this small subset and are already and are enrolled in an employer plan where you think you might be able to avoid enrolling in Medicare now without facing a penalty, you will need to actively disenroll into from the Medicare A and B that you get auto enrolled into based on that criteria we discussed. So we are going to chat out a link on enrolling using the ssa.gov login. Next slide. Thank you. So finally, remember to avoid late enrollment penalties and gaps in coverage by actively enrolling in Medicare during your initial enrollment period, the 7-month window we discussed earlier. If you want your Medicare coverage to start in the month you turn 65, you must enroll during the first 3 months prior to the month in which you turn 65. After enrolling in Part A and B, make sure to enroll in a Part D prescription drug plan or Medicare Advantage plan with drug coverage. Those enrolled in employer-sponsored insurance may be able to delay enrollment into some or all of the parts of Medicare, but should carefully consider this option and talk with their employer during their initial enrollment period to confirm they are able to defer Medicare without facing a penalty later. Medicare late enrollment penalties are costly and many are lifetime penalties. Now I will pass this back to Liesl.
Thanks so much, Anne. So now we'll talk about some of the challenges that Anne just alluded to in terms of penalties and deferring enrollment and so forth. So if you go to the next slide, please. So the first most common enrollment challenge is avoiding late enrollment penalties when deferring Medicare enrollment. So let's first talk about what the penalties are, and then I'm going to talk about how this ties into deferring coverage because you have employer coverage. So the Medicare Part A penalty only applies to people who don't qualify for premium-free Part A. So most people qualify for premium-free Part A by working and earning enough work credits over your lifetime. So anyone who doesn't have enough work credits to qualify for premium-free Part A and who also did not enroll in Part A when they were first eligible may face a penalty. You can avoid this penalty if you're still working and have employer-sponsored coverage. Medicare Part B penalty is similar. If you do not enroll in Part B when you're first eligible, you may face a penalty. The difference here is that the Medicare Part B penalty is a lifetime penalty, which means you pay a monthly penalty for as long as you have Part B coverage, so likely the rest of your life. You can avoid this penalty if you're still working and have employer-sponsored coverage, or if you qualify for a Medicare savings program in your state. One additional thing to note about the Part B penalty is that if you don't pay the penalty, your Part B coverage may be dropped. And so for this reason, it's really important to check in with Social Security if you're considering deferring enrollment. The Medicare Part D penalty applies to people who don't have prescription drug coverage, either through a Medicare Part D plan, a Medicare Advantage plan, or through other creditable coverage. So creditable coverage includes coverage through a current or former employee or union, TRICARE, the Indian Health Service, the Department of Veterans Affairs, or individual health coverage. So anyone who is eligible for prescription drug coverage through either of those routes but chooses not to enroll may face a penalty. And similar to Part B, the Part D penalty is a lifetime penalty as well. However, it's generally much easier to defer enrollment in Part D, and the Part D penalties are also significantly smaller and usually easier to resolve. So you can avoid the penalty for Part D if you're still employed, have not retired, and have qualifying insurance that includes credible prescription drug coverage. You qualify for the Federal Extra Help Program, also known as the Part D Low-Income Subsidy. And most Ryan White HIV/AIDS program clients qualify for this program, which is income-based. And in some cases, if you qualify for Medicare under age 65, you may be able to have your penalties forgiven once you turn 65. Next slide. So now that we've talked about penalties, let's talk about whether and how to defer Medicare enrollment if you have employer-sponsored insurance. I know this is a really big question for those of you who are aging into Medicare and still working, or your spouse may still be working. So if you become eligible for Medicare and you plan to keep employer-sponsored insurance, you should first check with your spouse's employer's human resources department. The employer can tell you if the plan they provide is considered qualifying insurance as well as creditable prescription drug coverage. So if it does satisfy those two items in terms of qualifying insurance, then the next step is to talk with your case manager or a SHIP counselor about which Medicare part or parts you can and want to defer. So for Medicare Part A, remember this is hospital coverage. So if you or your spouse has at least 40 work credits, you will be eligible for premium-free Part A, and you'll most likely be automatically enrolled. So people who aren't eligible for premium-free Part A coverage must actively enroll. And if you don't have enough work credits, you can continue to work until you qualify for premium-free Part A. You can always call the Social Security office to ask how many credits you have to check. And so generally, if you enroll in just Part A, you can also keep your employer's sponsored plan. And in some cases, a person's employer coverage may require that they enroll in Part A and B in order to get full coverage from their employer. So it's important overall to check with your employer when you're considering which parts to enroll in and which parts to defer if you're going to continue working past age 65. For Medicare Part B, you can defer Part B as long as your employer-sponsored coverage is considered qualifying insurance. And it's important to note that COBRA and a retiree plan are not considered qualifying coverage and will not exempt you from the Part B penalty. And then finally, for Medicare Part D, keep in mind that even if your employer-sponsored insurance is considered qualifying coverage, you need to check and make sure it's also considered credible prescription drug coverage. And so if you do have that, you can defer Part D enrollment without a penalty. But if the employer-sponsored insurance does not have creditable prescription drug coverage, you would need to enroll in Medicare Part D when you first become eligible in order to avoid the penalty. And so then it's also important to note that if and when you or your spouse choose to quit or retire from your job, that you'll have the employer will need to complete a Medicare enrollment form that you'll need to return to the Social Security Administration with your own enrollment form. So this is important because it helps to ensure that when your employment ends, you'll be eligible for a Medicare special enrollment period for job-based insurance that allows you to enroll in the parts of Medicare that you're missing and avoid penalties. So having that form from the employer helps to trigger the special enrollment period. Medicare coverage when you enroll through a special enrollment period begins the first month after you enroll. And you also want to do this in order to avoid a gap in coverage. So the best thing to do is to enroll in Medicare the month before you or your spouse's job-based insurance will end. And that will ensure you don't have a gap in coverage. Next slide. So the third most common enrollment challenge is transitioning from marketplace coverage to Medicare coverage. So the first thing to keep in mind is timing. If you're enrolled in marketplace coverage, you should enroll in Medicare when you first become eligible during your initial enrollment period, and this will help avoid late enrollment penalties and coverage gaps. The second thing to keep in mind is that coverage termination usually does not happen automatically. So once you're enrolled in Medicare, you'll still need to go back and terminate your marketplace coverage. So if you qualify for premium-free Part A, you can enroll in Medicare Part A during your IEP, ideally the month before your birthday. And as soon as you get Medicare coverage, or as soon as your Medicare coverage is active, you'll want to contact the marketplace to disenroll. If you don't qualify for premium-free Part A, you'll need to carefully consider whether marketplace coverage or Medicare is the best option for you. And if you do have advanced premium tax credits, you can keep those if you decide to keep your marketplace coverage instead of transitioning over to Medicare Part A with a premium. So making these decisions between marketplace and Medicare coverage and when to transfer can be complicated and includes comparing current premium costs and potential costs of late enrollment penalties. Next slide. So it's important to consider the following items when you're making this transition from marketplace to Medicare coverage. You need to check your mail frequently for any notices from marketplace or Medicare. Find out when your Part A, B, and D coverage begins before terminating marketplace coverage so you can avoid any coverage gaps, and contact the Social Security office if you encounter any enrollment issues. Next slide. So last but not least, we just want to quickly talk about the transition from Medicaid to Medicare. So in early 2020, Congress put protections into place for people enrolled in Medicaid to ensure that they were able to stay covered during the COVID-19 pandemic. And under this policy called the continuous coverage requirement, no Medicaid enrollee had their eligibility reviewed throughout the pandemic. But as of April 1st, the requirement is no longer in place and all states have begun to unwind their continuous coverage protection. So if you're enrolled in Medicaid right now, we encourage you to make sure you update your contact information with your state Medicaid agency. Check your mail frequently to be on the lookout for letters from your state Medicaid agency, and complete a Medicaid renewal form if you receive one. And if you're found to be ineligible, there is a special enrollment period that allows you to enroll in Medicare after termination of Medicaid eligibility, so that you won't have to wait until the next Medicare enrollment period to enroll. So we encourage you to contact your case manager, healthcare provider, and or SHIP counselor with help enrolling into Medicare and navigating this transition. And with that, I'll hand it over to Christine.
Thank you so much, Liesl. Hi, everyone. So I'm going to move us along to talking about financial help from Medicare. So just keep in mind that the slides that I'm about to present is basically an overview, but not an exhaustive list of financial options for Medicare. So whenever it's possible, you should always check for any state-specific or local programs that might be where you live. Next slide. So first, if you are eligible for the Ryan White HIV/AIDS program, that program can help you out with premiums and cost sharing for Medicare Parts B, C, and D coverage. So this is going to include outpatient and ambulatory health services under Medicare Part B, as well as prescription drug coverage under Medicare Part D. That includes at least one drug in each class of core antiretroviral therapeutics. The Ryan White program, Medicaid, and other payers may also be able to provide additional services such as case management and transportation assistance, things of that nature, that Medicare itself does not provide. Keep in mind that Ryan White program funds can't be used to pay for Medicare Part A premiums. But as a reminder, most people don't have to pay a Part A premium anyway if they have enough work credits over their lifetime to qualify for premium-free Medicare Part A. If you are a Ryan White client and you're not sure what the Ryan White program covers in your area, definitely check in with your case manager for details. Next slide. Now, some tips for using the Ryan White program to help you with the cost of Medicare. The first thing to keep in mind is that Medicare is always going to be your primary insurance, and the Ryan White program, including the AIDS Drug Assistance Program, or ADAP, will always be what's called the payer of last resort. So essentially what this really means is, let's say you're going to the pharmacy to pick up your medications, right? If you have a copay, you should be paying that copay with your Medicare Part D or your Medicare Advantage card first. And if there's a balance remaining, ADAP will be second if needed. So The reason for this is it's to help make sure that you're paying towards the deductible for your Medicare plan if it does have a deductible requirement. And the second tip is to be aware that premium amounts can change throughout the year. In order to avoid having your coverage terminated or accruing past due amounts, always keep an eye out for any notices in the mail about changes to your premium amounts. And this is going to ensure that the Ryan White program can continue to help you pay your Medicare premiums in full and on time. Next slide. Another financial assistance option that I want to share with you all today is called the Medicare Savings Programs, or MSPs. Now, MSPs are federally funded but state administered programs for certain low-income people. It's going to help pay for some or all of their Medicare premiums and out-of-pocket expenses. They are available to most people who are dually eligible, meaning those individuals who qualify for both Medicaid and Medicare. So I won't go into too much detail, but basically there are 4 different types of Medicare savings programs. And the first one is called the Qualified Medicare Beneficiary Program, or the QMB. This one is actually the most comprehensive and pays for all Medicare costs. And when I say all, I mean 100% of all Medicare costs. So that's, definitely the most popular one. And then the other 3 MSPs are the Specified Low Income Medicare Beneficiary, or SLMB. There's the Qualifying Individual, or QI, and the Qualified Disabled and Working Individuals, or QDWI programs. Now, these last 3 MSPs, they only pay for some Medicare costs. But overall, all 4 of these Medicare savings programs have slightly different eligibility criteria. Not every state will offer all 4 of these programs, and they might also have a slightly different name depending on where you live. But if you think you might be eligible for a Medicare savings program, you can apply directly through your state's Medicaid website, or you can contact your case manager or talk to a SHIP counselor to see what's available and what you might be eligible for. Next slide. So there is also something called the Extra Help Program, which we've mentioned before in previous slides. You may have heard of this referred to as the Part D Low Income Subsidy, or LIS program. So this is a federal program. It's going to help you pay for some or most of the out-of-pocket costs that are associated with Medicare Part D prescription drug coverage. Now, this program itself is not prescription drug coverage. You have to already be enrolled in a Medicare Part D plan in order to apply for program Extra Help to help with those costs. You can qualify for either full or partial assistance through Extra Help depending on your income and assets. You can enroll either through the Social Security Administration, online, or with a paper application. And if you happen to already be enrolled in a Medicare savings program, like I discussed in the previous slide, you usually will also qualify for the Extra Help program automatically. And since both the Medicare savings programs and this Extra Help program are income-based, most people with HIV who are Ryan White clients will tend to qualify for both programs. And just as a last reminder, enrolling in the Extra Help program is going to eliminate any Medicare Part D penalties that you may have incurred. Next slide. And finally, I just want to highlight some other sources of financial help. These might be specific to your state or your local community. So the first one here is they're called State Pharmacy Assistance Programs, or SPAPs. Now, these are offered in some states to help people pay for their prescription drugs. And that's going to be based on financial need, age, or whether someone has a certain medical condition, such as HIV, for example. The second one here is Patient Assistance Programs, or PAPs. These are offered by some major drug manufacturers to people who are eligible for that program. And depending on that particular program, you might be able to get a specific medication for free or at a very, very low cost. Each program has different requirements, including whether there's a copay and their application process. But I believe most of these tend to have online applications nowadays. And lastly, I'll just talk about the programs of all-inclusive care for the elderly, or the PACE program. These are state administered programs for people who require a nursing home level of care, but who are still able to live in the community. Most people who are eligible for this program are dually eligible for Medicare and Medicaid. And the PACE program will pay for some or all of their Medicare costs. If you think you might be eligible for this one, check with your state's Medicaid program to see if it's offered. And again, you can always contact your case manager or SHIP counselor for more information. I think in the interest of time, let's go on to the next slide, where I just want to share briefly some tools and resources that might be helpful to you all. Next slide. So on this slide here, this is a tool from the ACE-TA Center. This is a resource that's designed specifically for consumers called the ABCDs of Medicare coverage. It's a pretty short, plain language tool that describes the different parts of Medicare and the difference between original Medicare and Medicare Advantage. You can print this out to read on your own, or you can bring it to an appointment with a case manager or when you're meeting with a SHIP counselor. You can find all of our Medicare tools at targethiv.org/ACE/Medicare. And we also have a collection of consumer-facing tools for different types of health coverage. So we can chat out that link too. Next slide. So yeah, just want to wrap up and say you can always find out more about the ACE-TA Center at targethiv.org/ACE, and feel free to email us with any questions at acetacenter@jsi.com. So thank you very much, and I believe I am handing it over to Ronald.
Thank you, Christine. And wow, that was a lot. And I think it was terrific. It really was very much what I had hoped, and all of us at AIDS United and ANAC had hoped this would be. And we also know that this was really just the tip of the proverbial iceberg around Medicare enrollment. So we are already thinking, and will be designing as early as tomorrow, a Part 2 enrollment Medicare that will also address some of the questions that admittedly we will not have time to go into today that have come up on this webinar, but also to delve more deeply into Part B and Part C, Medicare Advantage, and the pros and cons, particularly for those of us who are living with HIV and other chronic conditions. Which kinds of programs are better? What kind of questions do we need to ask? So we'll be covering and Part D. So we hope to cover that those issues in a Part 2 of this series on enrollment. But one question that I quickly want to ask or just note was raised. Some of the questions have been answered in the Q&A box and the chat. But there was a question about what do you do if you if you are enrolled in Medicare and you don't have a case manager? Where do you get a case manager? Lisa, Ann, or Christine, can you speak to where do you get a case manager?
Sure. So you can get a case manager through the Ryan White HIV/AIDS program, and I will chat out the link right now to the hiv.gov locator. So through this locator, if you type in your zip code, it will show you all of the services available in your area. So first, it gives you the set of sort of testing, PrEP and condoms and Mpox vaccine availability. But if you scroll down and then select HIV care and treatment, there's a caret next to that. If you expand that, it'll say Ryan White HIV care. And there it'll show you where there are Ryan White programs in your area. And then you can reach out to the Ryan White HIV/AIDS program and get a case manager through your local program. The best reason for doing this is if you're not familiar with the Ryan White HIV/AIDS program, it provides wraparound care and services for people with HIV. And so they will be able to help you not only with those wraparound services, but also help you navigate what coverage is best for your healthcare needs, and be able to take into consideration the needs of your HIV care as well. So.
Thank you, Lisa. And the question was raised and it answered in the chat, but also just to reemphasize that the slides will be available following this webinar, and this webinar was recorded and will be available on the ANAC website and AIDS United's websites. As we reach the hour, and again, this was a fact-based filled webinar, I want to really express our appreciation to our presenters and Lisa and Christine. And I want to acknowledge the staffs, the policy staffs at AIDS United and ANAC, and the communication staff at AIDS United for helping to organize this webinar and the logistics of putting this webinar together. But most of all, I want to thank all of you for being here. I think we had a great attendance, which underscores how very important this topic is. And this is not the end of the road. This is an ongoing process. And really want to thank all of you for being here and validating how important Medicare is and will be to those of us who are already aging with HIV and the people under 65 who are approaching Medicare eligibility. So again, on behalf of AIDS United and ANAC, I want to thank you for participating. I want to again thank the presenters for this very informative webinar. Have a very good afternoon and thank you and stay safe. Bye-bye, everyone.